So, Doctor, your focus importantly is helping the underserved during this Omicron surge. How are people in the Bronx getting the help they need?
Well, the first concern patients have or people have is whether they have the infection or not. So they need access to testing. So we have over 20 sites that are doing testing, both rapid and PCR. And we have a mobile unit that works with the local leaders to provide access to the community on a mobile basis. Once people get the testing done, we are seeing a high rate of positivity, jump from 2% to over 10%. Then they need help with treatment, what to do next. So we have COVID program with specialists available to them, including infectious disease doctors that can help them in the treatment.
And talk about this because clearly there's an importance of focusing not just on everybody, but focusing on these communities that really aren't getting the same level of help and access to care.
Absolutely. So, Bronx is a very densely populated borough, 35,000 people in per square mile, as compared to 2,500 in Westchester, Long Island. Also, it has the essential workers, people who work in subways, who are working at stores, the frontline workers. Also, these kind of professions don't have access to remote work. So this all increases the ability to kind of take care of yourself while taking care of your family, because people have to go to work, and your exposure is much higher. And that is why we are seeing a much higher infection, both not in adults, but also in children in underserved communities.
Right. And Doctor, what are you seeing in these hospitals? Are you seeing more unvaccinated people? And to your point, what about the kids?
Yes, there is an increase in hospitalization in children, especially who have chronic illnesses, cardiopulmonary, chronic lung diseases, or immune issues. The hospitals are slowly and surely seeing an increase in the surge of COVID cases. Part of it is that people are getting admitted because they have COVID. Part of it, they are found to have COVID once they're admitted because they're admitted for other symptoms. So we are bracing up for this infection, and because the hospital staff and the healthcare worker on the front line, and the disease is very infectious, we are finding that they are the first one getting infected, and that is leading to shortages, and that is leading to more exposures.
What's the best advice for somebody who's watching right now who wants to stay safe? I mean, what do you tell people?
Well, everything they have been doing for the last year or two, wear mask, social distance, wash your hands. If you're in a public space, make sure it's not crowded, avoid crowded areas. And most importantly, get vaccinated or get your booster. Although we have a 75% vaccination rate in the New York City or New York State, but 1/3 of all those people have got their booster. And this vaccination protection wanes away after 6 months. So if you're eligible for a booster, you must get your booster.
And even with the vaccinations, people should still stay safe and vigilant. Dr. Sumair Sehgal, thank you so much for being with us. Stay safe, and of course, Happy New Year.
Thank you so much.